Hello, everybody. My name is Eric Fletcher, and I will be going over strokes in my video. So, the first slide is the basic information about my class. So, let's head over to the second slide. A stroke is a medical emergency caused by a sudden disruption of blood flow to the brain, which deprives the brain of oxygen and nutrients. The two main causes of strokes are blockages in the blood vessels in the brain called ischemic strokes and ruptures in the blood vessels in the brain called hemorrhagic strokes. The risk of stroke increases with age and is more common in men than women. High blood pressure, smoking, uncontrolled diabetics, high cholesterol, family history are all increasing risk factors of stroke. Stroke is the fifth leading cause of death in the United States and a leading cause of disability. It's estimated over 795,000 people in the United States had a stroke each year, resulting in over 140,000 deaths. Treatments of stroke includes medication, lifestyle changes, and sometimes surgery. We will also talk about more of the treatments later on in the slide. This slide talks about the most common strokes. We have ischemic strokes is the most common type of stroke, accounting for about 87% of all cases. This occurs when the arteries that carry blood to the brain is blocked, usually by a blood clot. The next one is the hemorrhagic stroke, occurs when the blood vessels in the brain leak or is ruptured. It can be from uncontrolled blood pressure, blood thinners, weak spots in the blood vessels, trauma such as car accidents, and protein deposits in blood vessel walls that lead to weakness in the vessel wall. Both types of strokes can cause permanent brain damage, paralysis, and even death. It is important to get medical help immediately if you or someone else is showing signs of a stroke. Knowing the warning signs and understanding the difference between two types of strokes can help save lives. This slide talks about the signs and the symptoms. So with the symptoms, it can be sudden numbness or weakness in the face, arm, or legs, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, sudden severe headaches with no known cause. Other symptoms may include drooping of one side of the face, slurred speech, weakness and numbness in arms and legs, loss of bladder or bowel control, difficulty swallowing, shortness of breath, unusual fatigue, and also seizures. Time is of the essence, as a stroke can cause permanent damage if not treated quickly. Ways to mitigate the stroke. So you have control your blood pressure. High blood pressure is a major risk factor of stroke. Two, you have to take your medication as prescribed. If you are taking medication to prevent or treat migraines, make sure that you take them as prescribed. Avoid triggers. Triggers can cause a migraine attack, which increases the risk of stroke. Common triggers include stress, certain foods, changes of weather. So it's best to identify what your triggers are so you can avoid them. Number 4, get regular checkups. Make sure you get regular checkups with your doctor. This will help to identify any potential health issues that could increase your risk of stroke. Number 5, manage stress. Stress can trigger a migraine attack and increase your chances of stroke. Make sure to take steps to manage your stress levels, such as exercising, meditating, and talking to a therapist. By following these steps, you can help bring down your chances of having a stroke. The next few slides will show you pictures of what's going on inside the brain. The slides before have talked about the wording of everything, but I think it's better if you actually get to see the two different types of strokes there are and what side of the brain they're attacking. You have a legend at the bottom, so what you're looking at you can understand a little better. from the colorations and from the different um, stages of what's going on in the brain. In this slide, you see the two different type of strokes, the ischemic stroke and the hemorrhagic stroke. So in the ischemic stroke, you can see in the brain stem, you see the blockage of the blood vessel. You see what actually goes on, or what we can actually produce as of right now, of what it might look like with a blockage in the blood vessel. And beside that, you have the hemorrhagic stroke, and you can see the rupture of the blood vessel and how it could cause that. This slide better depicts how each of them are done with the picture and the wording. So hemorrhagic stroke, it is caused by blood leaking into or around the brain from the ruptured blood vessels, allowing blood to pour into the affected area, thus increasing the pressure of the brain. You can see on the right side of the brain where you will see the actual rupture. The causes is brain trauma, brain tumor, malformations, and aneurysms. And then you can see the ischemic stroke occurs due to a lack of blood flow, and you see the causes is thrombosis, hypoperfusion, sinus thrombosis, and embolisms. This is the final slide, and it's my references, and you can see where I have got my information from. Information Now, article April 2022, Mayo Clinic 2022, Center of Disease Control and Prevention, CDC 2022. Thank you, and I hope you enjoyed my presentation.